specifically in Gen Z, we hear them saying we are aging faster.
When we live in a world of social media, it puts a lot of pressure on people to look amazing all the time, right? It's really difficult to say presenting our best selves all the time with filters and things. It's very difficult to compete. Men in the gym definitely use supplements which can promote acne.
You require to have some beauty sleep in case you want to have some good skin health, good skin barrier.
We are eating worse foods, psoriasis, eczema, acne, which can all be controlled or managed or even suppressed completely by
A glass of a red wine is going to keep you young.
To be honest, a couple of sips of red wine.
Hi everyone, and welcome to yet another episode of Skin IQ with Lemmorte, where it's a space for you to decode your skincare. This is Sweetie, your host for today, and I truly believe that skincare goes beyond products. It's about understanding yourself inside and out. So today we are going to explore some topics, very interesting topics, which are touching everyone: stress, perfectionism, and the emotional footprints it's leaving on us. Because let's be honest, when life gets heavy, it's the skin that bears its first marks. So, to bridge the gap between this mind and science, we have Dr. Simon Khela with us. He is the managing director for the leading private medical clinic chain in the UK. Dr. Simon, welcome to our podcast. I'm so glad to have and thrilled to have you here.
Thank you for having me.
I understand this conversation is going to be on your practical understanding, and we want to decode something which will give our viewers an understanding between what is actually affecting our healthcare overall and that is impacting our skin. So let me start with one question, which is, something which we have journalized and normalized: stress.
Yeah.
So we are all speaking about it, but it's kind of a very normal topic now. We are pushing ourselves toward hard limit. We are having a stress of being on top of everything. But I think that's taking a toll on our health and definitely on our skin.
Absolutely. I mean, stress is one of the biggest features of chronic disease. We all have to deal with stress day to day, right? And it's difficult sometimes to manage it. But what stress does is it spikes your cortisol levels. And this is a hormone which disrupts other hormones and can predispose you to chronic disease. So when we talk about stress, we talk about the immune system being dysregulated. We talk about having more inflammation in the body. And then you're more susceptible to getting conditions. And skin is a big part of that. We know there are so many inflammatory skin diseases like psoriasis, eczema, acne, which can all be controlled or managed or even suppressed completely by managing stress.
Okay, so when we say inflammation, definitely this is something which we are all speaking about, and this has been, topic of discussions also. But I'm sure a lot of us do not have a correct understanding of what inflammation is, and if I am being affected by it.
Yeah. Well, I mean, if you ask a functional medicine doctor or, a high quality immunologist, they will talk about inflammation as the root of all disease.
Okay.
70 to 80% of the immune system is actually around our gut. So when we don't eat well and we're very stressed and we're putting the bad things into our body, we're predisposing our body to producing inflammation.
Okay.
And that inflammation presents itself as physical symptoms. Or sometimes it can be anxiety if the inflammation's in the brain. It could be the skin if the inflammation presents in the skin. So managing stress and therefore managing inflammation is so important.
So this goes hand in hand.
Correct.
Understood. So again, when we speak about stress, there is one factor which I think is contributing a lot, which is obsession of having a perfect skin. So there are a lot of challenges which are being trending on social media, Instagram, like glow challenge.
Yeah.
Then these challenges are like endless. Then glass skin and all. Do you think these obsessions are also contributing to the health factors?
I think so. It puts a lot of pressure on people to look amazing all the time, right? It's really difficult to say. I think when we live in a world of social media and presenting our best selves all the time with filters and things, it's very difficult to compete. But I think we need to differentiate, normal skin to skin conditions which are medically diagnosed. It's very different to having blemishes and pores and scars, which are completely natural, to having conditions like eczema and dermatitis, which are medical conditions we can control.
So what you are saying is we need to understand exactly in case that we have a skin condition that needs to be treated. or something which can be, taken care ourselves?
Yeah, so there's the medical side of things, which you need to see a doctor about to get it, diagnosed and treated in the right way. But there's also the cosmetic side of skincare, which is a
Okay.
completely different world.
I understand that. But again, when we say about obsession, we've seen this trend specifically in the Gen Z that we hear them saying we are aging faster.
Yeah.
Do you think this is something which is really a factor to, take into consideration, or this is something which is just in the trends in social media?
I think a bit of both.
Okay.
I think the pace of the world is faster. I think generally we are eating worse foods. Our diet is changing significantly. A lot of us have more stress to deal with and
Right.
sleeping less, perhaps not drinking as much water and doing the basics as well. So I think all these do contributing to aging faster. And unfortunately, the skin being the largest organ of the body takes a toll, and
Right.
it presents as skin conditions.
Okay. So this is definitely a matter of discussion, cannot be
Mm.
discarded, but again, could not be obsessed with.
Yeah, no, I wouldn't be obsessed with it. I think it's important to do the basics right, lead a balanced lifestyle with good habits, eat well, sleep well, drink plenty of water. And these kind of things are very important. You've got to fit the basics and the good habits into your lifestyle, no matter how stressed or how difficult life gets.
Again, you mentioned twice, hydrating
Oh,
yourself,
yeah.
right? So I also wanted to understand from you. There is a lot of information about, hydrating yourself and
Mm,
having how many number of glasses per day.
yeah.
Do you think there should be something as a hard limit to it, or it depends on person to person?
It does. I think the average person should drink 3 to 4 liters of water a day,
Okay.
good quality water. And that's very helpful to maintain good quality skin. You can't manage a skin condition if you're not drinking much water at all.
Okay.
And equally, you don't want to drink, 7, 8, 9 liters of water a day because that could also have an adverse effect. And sometimes patients, we recommend they have electrolytes in their water, especially if they're training or
Okay.
they're going through periods of fasting. So yeah, hydration is super important. I think that's probably the number one thing you can do to maintain and improve skin.
But along with hydration, you have to have an active lifestyle also.
Yeah, I mean, exercise is super important. Exercise is very important for many reasons. It prevents chronic disease, it improves the blood flow to the skin. And it's just one of the principles that you should be leading in your life to improve your overall health.
Right. So I've heard this, and I'm sure this might be right, that if, as you mentioned, improve the blood flow to your
Mm.
skin, then definitely that's going to contribute into your face glow.
Oh yeah, definitely. And things that you shouldn't do. Alcohol's a big no-no. If you want to have really high quality skin, smoking reduces the blood flow to the skin. So these things are really important.
Got it. Also, Dr. Simon, we have seen that now beauty trends,
Mm.
they are changing as fashion changes,
Yeah.
right? There are a lot of trends in this thing, the tricks, the trends, the kind of hype around the ingredients, specific ingredients getting, tagged in every influencers or every Instagram post.
Yeah.
How do you, respond to these kind of trends, or I'll say marketing gimmicks?
Yeah, a lot of them are marketing gimmicks, unfortunately, because they want you to buy the product. I think if you've got a skin condition, if you've got a worry about your skin, the first thing you should do is apply the basic principles of a balanced diet, exercise, drinking well, and sleeping well, and then see a doctor. Because if there's a medical condition underlying what's causing your concern, then at least we can manage that as medics. But then it's a case of doing the basics right. Good quality moisturizers, good skincare routines. Make sure your face is clean and exfoliated and well managed.
Okay, so when you mentioned the skin concerns, the
Mm.
first thing that came to my mind is acne,
Yeah,
right? I've heard this most of the time that some people they get acne breakout if they're exposed to some conditions like sun exposure,
yeah.
or maybe they had some wrong kind of in food or something.
Mm.
But I want to understand from you. I do understand that inflation may will play a role in the acne breakouts also. But what is your take on acne in men? Right, we see a lot of Instagram influencers also
Yeah.
promoting that.
Yeah, I mean, acne we see in two major groups, teenagers as their hormonal profile changes as they get older, and as men get a bit older and start going to the gym and using supplements,
Right.
it's a growing problem, it's a growing concern because, men in the gym definitely use supplements which can promote acne. And high levels of testosterone, by boosting it using different supplements, can cause a breakout. So I would suggest, to men who go to the gym, simple supplements like creatine and a high protein diet is as much as you need to do. If you start taking things like testosterone boosters or steroids and things, they can cause huge spikes in hormones, which can cause acne breakouts.
Couple of things that I picked up from what you told, and I want you to, give more information about it. One is regarding the food habits. So right now, again, because we are stressed, we are swamped with work, we do not have that kind of time in hand to have that kind of imbalanced diet. We are focusing on specific diet charts. Again, these are again very trending topics. We have applications who are supporting in and helping you track and suggesting what should you have in the breakfast, dinner, and snacks times and all. So intermediate fasting, GM diets, or these kind of keto diets. Like, do you recommend those?
I think with diet, I think it's the most important thing is what you can maintain.
Okay.
We can all do a keto diet for a week or a carnivore diet for a week, but it's important you have a balanced lifestyle, because that's what you can maintain, that's what you can keep doing. And if you apply the basic principles of eating a good balanced meal, drinking plenty of water, and good sleep, and then you wouldn't go too far wrong. A lot of the diets we see, like keto and carnivore, low carb diets, they're generally short lived, and again, they seem to be a quick fix in many respects.
Okay.
What we do know from the research is that a diet in low processed foods is the best diet. There's a lot of ultra processed foods, especially the protein bars that people eat, or if we go out and have a meal, generally they can be processed, or high in saturated fats, using poor quality oils to cook in. These kind of things you want to avoid.
Right. So let's say, for example, I want to go for a specific diet, a balanced diet, for example.
Yeah.
But now I have so much of an options of going on different, applications for that another part. Do you think something that works for, let's say, for example, keto diet that works for somebody should also work for me?
I mean, it's very dependent on person to person. Definitely. I mean, it depends on multiple factors, and diet's not the only factor.
Okay.
I think a ketogenic diet, for example, which essentially means very low carbohydrates,
Right.
Can reduce inflammation for sure. And not everybody needs to go on a ketogenic diet. For some patients, we do prescribe it because they're either, diabetic and it's going to be very helpful for them. But in a general healthy individual, a ketogenic diet is not required. It's better to have a balanced diet.
Again, when we speak about diet, there's something which comes into our mind that's packaged food.
Yeah.
Or quick bites like protein bars and other things, because we are skipping our meals, we are not taking our meals on time. And do you think that is also contributed to your skin health?
Definitely. Like I said before, these things are ultra processed and they're pro-inflammatory, which means as soon as you eat them, they disrupt the gut, they disrupt the immune system, and you get a spike of inflammation in the body. And that's just going to present itself as things like, various skin conditions.
Got it. You did also mention something about smoking and alcohol initially when we started our conversation. I wanted, you to cover that part a little more. Because there are some habits which are also taken as, a prestige matters or a lifestyle. Unavoidable things like smoking, alcohol. We sometimes blame our lifestyle or the kind of an environment we are into it, and even the screen time, the binge watching and all. So do you think these are all contributing into our skin health or overall health also?
I think so. I mean, a lot of the studies do show that alcohol consumption and smoking does affect us, in any form of chronic disease. I think with alcohol in moderation is okay and it's acceptable. We're social beings, and if that's what you decide to do, it's okay. But I wouldn't drink in excess because it can just dehydrate the skin and affect its growth and repair. Smoking is particularly bad for skin. It really reduces the oxygen to the skin and the blood flow, which can again increase the aging process as well, and we can get more blemishes, we can get more wrinkles on the skin, and look quite dehydrated.
But sometimes we do hear that people are taking, alcohol or the beverages as a medicinal effect. For example, red wine.
Yeah.
So I have been told sometime, a glass of a red wine is going to keep you young.
Yeah, I mean, it's probably not true. to be honest, because we don't just have a couple of sips of red wine to get the benefits of the polyphenols that are in it.
Right.
But generally would drink one or two glasses, and I think generally the risks will outweigh the benefits
Okay.
of that.
So your advice would be in moderation.
Exactly. I mean, in moderation. If you don't need to take it, don't take it. That's the best advice. But if you do enjoy some alcohol, then in moderation.
That's completely a personal
Yeah,
choice,
exactly.
lifestyle choice. Okay. Something that I want to discuss is a sensitive topic around steroids.
Yeah.
We often hear that, these are a little quick fix or maybe prescribed by the healthcare practitioners as well to treat some, major issues. So what is your take on those?
Steroids as a cream is widely used around the world for skin conditions. It's generally used whenever people have a breakout in conditions such as eczema.
Right.
Now, they're very good in the sense that they reduce the inflammation very quickly, but sometimes it can come at a cost. So, the constant use of steroids can thin the skin, they can cause pigmentation of the skin. So, it's not advised, and we only use it in an acute flare up of a skin condition generally. I think it's the maintenance of the skin and preventing the flare-ups, which is so much more important.
Okay, understood. We've also heard that these quick fix could be steroid or anything else. There are a lot of quick fix with respect to skincare which is in the market. They only work for the time that you're taking it or you're exercising that.
Exactly.
But the skincare skin issues again appears the same as it was before if you stop using them.
Yeah. I mean, it's papering over cracks, isn't it? I mean, if you've got an underlying health issue, if you've got a poor diet and you're chronically inflamed, there's no amount of, cream or anything that's going to stop that. So you need to fix from within. And then once you've got that on track, then you can, think about skincare routines and different types of creams.
Okay. So you may need to go for a specific therapeutic skincare regime as prescribed by your dermat for specific conditions.
Correct.
How about antibiotic? How different they are from steroids?
Antibiotics are totally different to steroids. They're generally prescribed in creams for acne, or they can be given as a pill. They're very effective in conditions such as acne, where we know there's a bacterial component. So it works to break down the bacteria. But that usually should be prescribed and given by a doctor who's reviewed your skin. A dermatologist, for example, may think it's indicated for your certain condition. But we also know that in acne, we tend to give antibiotics for a longer period of time than most illnesses. So in a cough and a cold, or you've got a chest infection, it may be a week, but in acne, it could be up to 3 months.
Oh.
And prolonged use of antibiotics can therefore disrupt the gut, and that can worsen the immune system and cause more inflammation. So it's a bit of a trade-off, and it should only be taken if it's really necessary.
And only if it's prescribed by your practitioner.
Your doctor, yes. It should be prescribed for a good consultation with a medical doctor.
Understood. Also, you mentioned chronic diseases, and from there it clicked me genetic issues. So there's two questions that I wanted to understand from you. One is, if you have some genetic conditions, for example, diabetes, hypertension, or something like that, should you take into consideration those? And the second one is, I do have examples of people who have had genetic issues.
Yeah.
They might be aware or not be aware of it, but they are not addressing those properly. So should that be addressed? Should it be given? How much consideration should be given to these genetic issues?
Yeah, that's a good question. I mean, we can't help the genetic conditions that we're dealt with, right? But we can all have a balanced diet and work out and sleep well and, limit alcohol consumption and not smoke. So I think regardless of whether you have any predispositions through your genetics, I think we should all have the same kind of mantra of living a healthy, balanced lifestyle. And if you do have comorbidities, which means you have other conditions, that's even more reason, right? To address your lifestyle and habits.
So we need to pay a due consideration to our genetic issues, right?
Yes, absolutely. You need to manage these conditions well, because we know people who have any form of condition are likely on treatment, are likely on medications. They're likely more inflamed than other people. So it's just a case of keeping an eye on these things.
And that's definitely going to affect your skin health.
Well, it's hard to say. I mean, not all conditions affect your skin health, but you're more inclined to develop skin issues, I guess.
Understood.
Also, the side effects of the medications you may be taking for that condition which can affect your skin health too. So it's just being more aware.
More aware of yourself and taking
Yeah,
a proper
exactly.
medications and care.
Correct.
Understood. Also, Dr. Simon, there's a huge misinformation about sleeping patterns, the amount of sleep somebody needs.
Yeah.
I often hear this thing, beauty sleep. You require to have some beauty sleep in case you want to have some a good skin health, a good
Yeah.
skin barrier and all. What is your take on it? How much sleep is actually required? Is there some difference between the hours of sleep required by a man and a woman?
I think the hours you need to sleep is generally the same.
Okay.
I don't think it's significantly different. But we know that sleep is your recovery phase.
Right.
Sleep is super important for the whole body, whether it's the joints, whether it's your skin, whether it's your hair, whether it's even your metabolism and your gut health. Your body needs that 7 or 8 hours where it can rest and recover, repair. The cells need to break down, they need to regrow, they need to repair. And if you're not giving yourself enough sleep, then your body just doesn't have the ability to do that.
So we're just repairing ourselves.
Correct. And that's why sleep is super important.
Understood. I take that into consideration. Okay, so one very interesting question that I have for you is the kind of an applications and the data that we use with all these gadgets. So we are right now keeping a track of number of glasses of water we take.
Yeah.
The calorie intake, this air about number of steps that you need to take, 10,000. And then there is everybody needs different kind of steps another part. And people are getting obsessed with it, obsessed to a level that, they're being guided by their gadgets exactly what need to be done. What is your take on that?
Well, it's interesting. I use it myself and I get reminded to drink water every day. So I think it's helpful in many respects. I think it's a good prompt for people because sometimes we're so busy. And if you just see it on your phone, have you drunk enough water? Have you done, your 8 to 10,000 steps a day? I think they're very, very good and they have a place. And people are becoming more aware of their health and preventing disease and, better lifestyle options. But I think equally you can be quite consumed by it. And I think it's important that you don't become consumed and obsess over these things because that can then lead to anxiety, perhaps more stress that you haven't hit these numbers and targets.
Right.
And that ultimately can cause, a dysregulation of the immune system by increasing your cortisol again. So I think it has its place. I think it's important and I think it's great. But I think just manage the expectations well.
So it should be we managing the gadget, not the other way around.
Correct.
Okay. Thank you so much, Dr. Simon, for your time. It has been a very interesting discussion with you. It was a blend of science and it was a blend of your practical experience. And there was a lot of empathy with the questions that I had with me. And I'm sure our viewers are going to love that. Thank you so much.
My pleasure.
Sure. For our viewers, if you have liked this conversation, do not forget to like, subscribe, and share. In case you want us to cover any specific topic or you want some specific guest in our next podcast, please leave a comment. Till then, take care of your skin and of course of yourself.